Good morning, I'm Dr. Marianne Gale from New South Wales Health with the COVID-19 update for today, Thursday, the 4th of November. In New South Wales, in the 24 hours till 8 p.m. last night, there were 308 locally acquired cases of COVID-19 reported, and more than 94,000 COVID-19 tests also reported. In terms of vaccination, across New South Wales, 93.7% of people aged 16 years and over have received a first dose of a COVID-19 vaccine, and 88.7% of people were fully vaccinated. In the 12 to 15-year-old age group, 79.6% have had a first dose, and 65.1% have received 2 doses and are fully vaccinated. In terms of COVID-19 cases currently in hospital, there are currently 302 people admitted to hospital, 64 in intensive care, and 31 of whom require ventilation. Of those people in ICU, 51 are not vaccinated, 6 people have received a first dose of a COVID vaccine, and 7 people have received 2 doses. Sadly, today, New South Wales Health is reporting the deaths of 4 people, 3 men and 1 woman. 1 person was in their 30s, 1 person in their 70s, and 2 people in their 80s. 2 people who passed away were from southwestern Sydney, 1 person from western Sydney, and 1 person from the Shell Harbour area. 2 people who passed away were not vaccinated, and 2 people, both of whom were in their 80s and had some underlying health conditions, had received 2 doses of a COVID-19 vaccine. A 38-year-old woman was from Western Sydney and died at Royal Prince Alfred Hospital. She was not vaccinated and had underlying health conditions. A man in his 80s died at Royal Prince Alfred Hospital. He was a resident of the Greek Orthodox Community Home for the Aged in Earlwood, which is also where he acquired his infection. On behalf of New South Wales Health, I extend my sincere condolences to the families and the friends of those 4 people whose deaths we report today. In terms of sewage, New South Wales Health's ongoing sewage surveillance program has detected fragments of the virus in a number of places where we currently are not aware of any known cases. And those places are Holbrook, Merimbula, West Wyalong, Manila, and Uralla. Everyone who lives in those areas, I strongly encourage to be extra vigilant for symptoms. Please come forward for testing if you have even the mildest of symptoms, and please stay in isolation until you receive a result. New South Wales Health has today seen an increasing number of cases in the Moree region of Hunter, New England, and I particularly encourage anyone who lives in the area of Moree to be particularly vigilant, and if you have even the mildest of symptoms, please get tested. And we particularly want to see even higher vaccination rates in the Moree area. So if you live in Moree and you haven't yet got vaccinated, either your first dose or your second dose, please, now is the time. It's particularly important to come forward for vaccination as we see increasing case numbers in Moree. And I'd like to particularly encourage members of the Aboriginal communities living in and around Moree, because we are seeing some cases amongst Aboriginal people in those areas. So please, for the Aboriginal community in that area, please be extra vigilant for symptoms and please come forward for vaccination. New South Wales has reached a notable milestone in our fight against COVID-19, and that is that we have now done more than 20 million tests since the beginning of the pandemic. And coming forward for testing when you have symptoms is absolutely important, even if you are fully vaccinated. So please continue to do so. It's going to be very important as we go forward that if you have even the mildest of symptoms, even when you're fully vaccinated, important to get tested promptly and stay in isolation until you receive a result. I want to also thank the community again for coming forward in the great numbers that you have to be vaccinated. We know that vaccination remains a critically important means of reducing our individual risk of becoming seriously unwell and ending up in hospital, and also reducing the risk of transmitting COVID in the community, and importantly, transmitting it to those loved ones around us, particularly those who are elderly or who have underlying medical conditions and who are at risk of catching a more severe disease. We want to see our vaccination rates increase even further, and a particular reminder to people who've had a first dose, please come forward to get your second dose. 1 dose of vaccine is great, 2 doses are even better, so please come forward to get your 2 doses of vaccine. And if you're 18 years or older and you've received your second dose at least 6 months ago, you are now eligible to get a booster dose of the Pfizer vaccine from New South Wales Health vaccination clinics. And the booster shot is very important, and there's good evidence that it helps us maintain an even higher level of protection against the COVID-19 virus, including the Delta variant. It's also incredibly important that our 12 to 15-year-olds continue to come forward for vaccination. It's really terrific to see those vaccination numbers in that age group continue to rise, and we want to see that continue. So for those out there who are aged 12 to 15 and parents of those aged 12 to 15, please come forward for vaccination. There are many options for vaccination through New South Wales Health clinics, GPs and pharmacies, and we know that vaccines are safe and effective and they are free. So please come forward for your vaccinations. So again, thank you all very much for your continued efforts to stop the spread of COVID-19. Please get vaccinated, please get tested, please stay safe. Thank you.